Good afternoon. My name is Robert Martiniano. I'm Senior Program Manager at the Center for Health Workforce Studies. Thank you for joining us. I apologize for my voice. The change in seasons has kicked my butt a little, so if it sounds like I'm losing it, you'll know why. With me today, I have Lauren Boyd and Shen Wang, who also work on DISRIP with me, and we are also the technical assistance team, and we'll go through that. Also on the phone call is Sarah Schauman, with the New York Presbyterian Queens PPS, and Isaac Kastenbaum with the New York Presbyterian PPS. So they are the workforce leads, and we've been working with them to get the materials ready as well as for this presentation. Okay. So let's begin. Just some basic information on the center. We have been in existence for over 20 years, and we've been working with PPSs over the last 3 years on data collection as well as other things around the workforce. Okay. Oh, just a side note. Everybody's on mute right now. If you have a question, either use your chat box or raise your hand. If there have been a few more people, we would have unmuted everybody, but given the number, I didn't want to kind of have too much confusion. So we will open it at times, so at the end. But again, if you have questions during the presentation, we read your questions through chat boxes or raise your hand and we'll get to you. Okay. Let's start first talking about the, did I skip the slide? Yes, I skipped the slide, sorry. Sarah's going to talk a little bit about DISRIP and the PPS workforce survey and how it interconnects. Sarah?
Thank you. So thanks again, everyone, for joining us to go over the workforce compensation and benefits survey today and the technical components of the document you guys will be receiving. So just a little bit of an overview about workforce from the PPS side. So both Isaac and I are the leads for the DISRIP workforce for the NYP PPS and the NYP Queens PPS. And so many of you should already know this information, but just as a refresher, the DISRIP program is a reinvestment of Medicaid funds into the state to help do care design transformation over the course of 5 years. The DISRIP program will be ending in March of 2020. And workforce is one of the key work streams that the state has been pushing for us to do and that we are paid for performing in. And so these things included a training strategy and a roadmap for how the workforce may be impacted through DISRIP and our care design changes. And one of the key elements is a compensation and benefit analysis. So the comp and benefit analysis we are required to do during year 1, we're required to do during year 3, which is what we're going to talk about today, and then again in year 5. So many of you worked with us on this in the earlier years of DISRIP when we submitted this, and so a lot of this should seem familiar to you from that point. And so the workforce survey is going to be done by all of the organizations in both PPSs so that we can ensure we're continuing to align with organizational needs and state needs through DISRIP. And so Robert and Lauren are going to talk a little bit more about the technical components and what you'll find in the survey this time around. Thank you.
Thank you, Sarah. So I want to talk a little about what we're going to do here. We're providing technical assistance as you go through this process, and that includes a couple of things. One is we have a website that when we sent out the email earlier this week, it was linked to it. And it's got a number of pieces of material on it that we will talk to you about today. Also, we can be reached by email or by phone. You'll notice at the end of the slides, my contact information is up there again. So you'll be able to contact me as you need me. And we will help all along the way. Okay. So as Sarah said, we are administering this year 3 workforce and comp and benefit survey. We actually did independently of each other year 1 for both NYP and NYPQ, And this year we're actually combining them. So what are we asking for? We're asking for a count of the current staffing, and we'll go into what that means and how that's collected, as well as compensation and benefits. What are you paying your people? What are the associated benefits for those people? And in order to do that, however, we have to follow antitrust rules, federal antitrust rules. So we're going to actually go into that in a little bit, exactly what those rules are and how we're ensuring that they are followed. So we started with an email that we received from both, I'm sorry?
That they sent out.
Yes, that NYP and NYPQ sent out, and that we used to also send out to you with our link. So again, included a link to the survey as well as a link to the website that we have that has a number of pieces of information on it that can help you complete your survey. And we will talk about that. And again, we are available both by phone and email to help you complete your survey. Okay. So the first thing I want to talk about is the importance of saving the PDF to your hard drive. I can't stress that enough. So first off, let me talk about this. It's a fillable PDF, and the reason why we did that, you can actually save it, send it to other people who may need to fill it out. They can send it back to you when they filled out their sections, and then you can send the PDF to us. That becomes more difficult when you do an online or an internet survey. But it is so important that you save the PDF to your hard drive or your memory stick first. If you fill it out and then send it back, it's going to be sent back blank and you'll reopen it and there won't be anything there. So please remember to save it to your hard drive. In some cases, and again, we'll talk about this in a little bit, you're going to have multiple copies because this needs to be submitted by facility type, and we'll go over that in a bit. As you save the PDF to your hard drive or your memory stick or whatever, make sure if you've got to respond multiple times that each have a different name. And I mean, here's one example of a naming configuration, but you can do that. And again, we're going to talk about the facility types in a little bit. Okay. So in order to kind of standardize the data collection, we're making the data that you need to use as of September 30th. And part of that is because of the antitrust rules, which we'll go over. And we're going to use it to compare trends. We're going to provide it to both PPSs to understand where they are, you know, because we're in year 3 essentially, where they are in the process, how things have changed, how things may not have changed, and to use to compare against some of the initial work they did. Okay. Okay. So let's talk about comp and benefits a little. And as I said, we've got to follow the federal antitrust laws. So the first thing is that the data's got to be 90 days or older. So by doing it September 30th, as of January 1st, we can provide each of the PPSs with their data. It also must be reported in the aggregate, so anything that we report to the PPSs will be in aggregate, and we also have to be aware of the cell size. So if we get so we may get 100 surveys back, but there may be a job occupation that's only got 4, we can report the numbers, the FTEs and the number of bodies, but what we can't report are the compensation and benefits. So we are very mindful of that, and we will be following all those rules as we submit it. And the first one, it says a third-party collection. So neither NYP or NYPQ sees the raw data. All they see is our chart, and that data is protected, and we won't share it with anybody. As you think about reporting your compensation and your benefits, what we're really talking about is your base rate pay, and we'll talk about that in a little bit, as well as the fringe benefits that are associated with those positions, which is, do you get health insurance, life insurance? There are basic things that everybody gets, such as they have to pay in FICA and workman's comp. So all those things are part of the fringe, and we'll talk about how that can be calculated in a little bit. Okay, so let's go, let me stop right here and see if anybody has any general questions before we'll unmute for a second. And if anybody has any questions, shout them out or raise your hand before we get into kind of the nuts and bolts. Okay. All right. So no questions so far. And again, as we go along, you can also raise your hand or type something in the chat box. So the first section is basically to understand who you are. So what's your name, what's your street address, and the contact information. So a couple of things I want to talk about. One is there is a pull-down box for facility type, and we'll go into that in a second. What are the facility types? What we consider for full-time hours. So let's talk about that a little. So if you're, let's say a CBO or, some kind of community organization, everybody may be on the same hours, 40 hours, 37.5 hours or whatever. That's not necessarily true in healthcare occupations or in healthcare facilities. So if you are an organization that everybody, no matter who you are, is 40 hours, you can just put that down. And I'll explain why we're going to do that in a second. If it differs, let's say full-time for nursing is 37.5 or 36, and other staff may be 40 and some may be 35, then you're going to want to do it for each section. And we've done that, so this is not something that's reportable, but we're doing that to understand FTEs if we have to go back to you and say, how did you calculate this, or if we're looking at this. Fringe benefit rates, kind of the same process. If you have one fringe benefit rate throughout your whole organizations after you calculate it, then you can just put it here and you don't have to fill out the individual boxes. But again, if you're a larger organization, you may have multiple contracts with unions or other providers or whatever, however you kind of do your staffing. And you may have different fringe rates for different occupations. In that case, we're going to want it individually. Also, we're asking that, are you responding for a single site or multiple sites? And if you put single site, we've got your address. If you put multiple sites, there's section 3, which you'll fill out, which we'll show you in a little bit, that will cover sites 2 through 15 or so. So your first site would go on section 1, and the remaining sites would go in section 3. The other thing I skipped that I want to go back to is the checkbox for what PPS network you're in. It's potentially that you're in both the Presbyterian, New York Presbyterian, and New York Presbyterian Queens. You only have to submit one for each PPS that you are in, and if we find that you're in both, we will spread them. Now, just remember, one of the things that we have to talk about is you're submitting for each facility type. So you may be submitting 2 or 3 based on facility type, but still covering both PPSs. Okay. So here are the facility types, and these are defined by the Department of Health. So there are 9 facility types and an other, and as you can see, some of them are combined. So like the 5th bullet down, you'll see hospital inpatient ER. That also includes hospital inpatient for people covered under Article 31, which is mentally disabled individuals, and people under Article 32 are individuals with substance abuse. That's all collapsed into one. You'll also notice that outpatient for those 2 are collapsed together, but are different than hospital outpatient clinics, that are also different than either diagnostic and treatment centers that include FQHCs, or that are different than private practitioners. Okay, yes. So we have a question, and the question is, does home care agency hospice include LICSAs as well as CHAs? Yes, it does. So home cares would include, I can't remember my definitions offhand, my terms. CHAs, community, or Geez, I'm spacing out. CHOS, LICSAs, long-term home health care agencies, hospices. It won't include the county because I don't think New York State County has, or New York Department of Health has a CHA in their group, but any outpatients. So the VNS of Albany, VNS of New York City, and other types down there.
It's certified home health agency.
Thank you. Certified home health agencies, licensed home care agencies. My apologies, I kind of spaced out on those two. But again, so anything that's covered by home care agency or hospice is in that category. If you have a question about what your facility type is, please reach out to us and we will work. If we can't answer it directly, we will reach out to either Sarah or Isaac or their staff and get an answer for you.
You have a raised hand.
I'm sorry?
You have a raised hand. I'm gonna
I have a raised hand, okay. Terry, you can go ahead and ask your question, please.
Hi, if you were in, an Article 32 and an Article 28 at the same location, do you put both?
Yes, you would need two separate surveys. That goes back to the facility type thing. So each facility type needs a separate survey, regardless of how many sites you have. So if you have 5 sites that are all Article 31, and each of those sites also have an Article 28, you're going to be reporting them 2 different surveys, one for the 31 and one for the 28, even though you have separate sites. Terry, does that help?
Yeah, and if they're the same site, you still report it separately?
Twice. Correct.
Yep. Okay, thank you.
FTEs.
Yes. And we're actually, there's going to be an issue, and we'll talk about FTEs when we get to about how to allocate FTEs among the different facility types, especially for things like administration and other type titles that may kind of be more of an umbrella title than just I have a nurse working in this section. Okay. So again, if you have any questions about what your facility type is, please let us know. So let me give you an example of an other. Not so much in New York City, but a Department of Health would be an other if that's part of your PPS. Also, if you're an Article 31 or 32 residential care facility, that's not inpatient, so a group home or something, that would be considered other. Again, if you have any questions, please let me know, and we will work it out and figure out what you are. Okay. So let's go into the data a little. And as you can see, we asked for a number of issues, number of things across the top. And again, it's as of September 30th. And the first thing you do, if you notice all the way to the left in front of the 01 primary care, there's a box. As you go up and down the list of occupations and titles, you'll see those boxes. If you check those boxes, it highlights that row. If that row's not checked, if that box not checked, you don't have to fill out the row. And that brings me to another thing. You only have to fill out for those occupations you have, so just ignore the ones you don't have.
Okay, we have some questions.
I'm sorry?
We have questions.
All right, we have a couple of questions. All right, the question is, if you have 3 physical sites, executive and administrative, CHA and LICSAs, do you still file as one site? Yes. As long as it's the same facility type, you only have to fill out one survey. It's when you have multiple facility types that you fill out. Okay. So if the CEO is covering, sorry, if the CEO is covering multiple facility types, then you portion out the FTEs. So let's say you've got 4 facility types. You're inpatient, outpatient, mental health, substance abuse, and regular Article 28. You're going to portion it by, let's say you say, well, it's about even for everybody. So you'd count it as one body, but it'd be 0.25 FTEs. And that's how you would do it across the things. Now you may say, well, it's really not, my inpatient is a lot larger than my outpatient, so I may be 2/3 for my inpatient, 0.67, 0.16 and 0.17 for my other 2 sites. So you're gonna, this is not exact science. as you look through and as you fill it out, kind of guesstimate what you think the FTEs are. But remember, it's one body for each. The head count is always one body regardless of how many FTEs there are. So there is going to be some duplication in the number in the head count because of that. Any other questions?
Nope.
Okay. And again, if you need some more clarification after this, I'm available to discuss this. Also, this is being taped. I didn't say this up front. So you can go back and look at this if you need some clarification as you go through. Okay. So the other thing I want to talk about, at least in this initial stage, is your job descriptions or your titles. And there's about 100 of them. I've kind of lost track. But we have documentation on the website that describes each of these titles. So if you say, well, that's not really a title I use, you may find that's a very similar title and you can put it in. If you just look through them all and say there's just no title here like this, then we have some other categories. You know, for example, we talked to one hospital, we have psychiatric tech or psychiatric aid is in this description. And one hospital told us, well, we don't call them that, we call them behavioral health techs or something, behavioral techs or aides. It was essentially the same title when you read the definition. So just look at what titles you have, look at what titles we have, and then see how they relate. And again, we have on the website, we have a whole list of occupations and how they're described. Let's talk about physician issues a little, because some people have physicians on staff, some people contract with physicians, some people have just attendings, and most organizations have some combination if you're in healthcare. So what we're really looking for, and this may also apply to nursing homes who contract for maybe OT or PT, but we're looking for people on staff. So if they're attending, don't even consider them whatsoever, because they're coming in, looking at their patients and leaving. If they're on staff and you employ them, yes, we definitely want them. If they're under contract, please call me and we'll work with you in the PPS to figure out if it needs to be documented or not. Depends on how the contracts work. Again, this is a little trickier, so please reach out to us if you have any questions. Okay. So let's talk about the general survey. So let's start with the head count. So again, for every body you have, regardless of how much time they work, they're counted as one. And as I said, kind of answering the previous question, if you're having to split your bodies and your FTEs among different facility types, you're counting the head count in each facility type, even though you know they're only portioned out or they're a portion of each of the facility types. When it comes to FTEs, you're calculating them based on what you consider full-time for that position. So for example, if you have 20 nurses and your full-time positions would be 40 hours, in theory, you would have 800 hours if full-time. Let's say when you added up all the hours they worked, you only had 600 hours, then it's 0.75 FTEs for each nurse on average, or 15 FTEs. So in that example, you've got 20 bodies and 15 FTEs. And again, you can do that throughout the whole thing. Again, if it's a provider or a person that cuts across multiple facility types, try to apportion them out the best you can. Now, there's another question that some of you, especially in Queens, may have, that what happens if I have somebody, like one of my CEO, we have some sites on Long Island. You don't have to include those. So let's say you may just say, well, 2/3 of my CEO or my IT or my vice president or whatever work on Queens issues under the Queens PPS, but another third work on Long Island. Exclude the other third. We're only looking for FTEs that relate to the Queens PPS or the Manhattan PPS. Okay. So any questions about FTEs before I go on? I'm looking at the, okay. Number of vacancies. So one of the things that Department of Health has asked, that we're asking about is, how many vacancies you have. And depending how you budget, you have to think about your vacancies. So some people may have vacancies based on, we've got it open, but we're really not trying to fill it. That it's just there from a budgeted point of view, but we're not actively recruiting. So we're really looking for those vacancies that you're actively recruiting for. If the vacancy is filled by a temp worker, it's still considered a vacancy. And again, call us if you have any questions. Again, but think about it. Is there an intent to fill? Are we actively recruiting? Okay. Let's move on to average hourly wage. So again, so going back to the example of the nurses, you got 20 nurses, figure out what their average salary is per hour. And we're asking per hour because it's very difficult to do it. If you say, well, my average salary, for a full-time nurse is $60,000, $70,000, whatever it is. But some are working full-time or some are working part-time, it's very difficult to calculate. So we ask for hours because it's easier to adjust that way. And as you see in this definition, we're asking for, it should include the base rate, whatever cost of living increase they might have gotten this year by September 30th, any longevity pay they might have gotten by September 30th. We, however, exclude bonuses, any type of reimbursement or allowances, any shift differentials or overtime pay. So we're really just looking for a straight salary. And again, what we want is the average for that title. So I'm going to give an example. So if you add up all the salaries, you got 10 people, you average up all the salaries, and it comes to $250,000. It would be $250,000 divided by 10, and let's say they worked 2,000 hours a year. It'd be $12.50 an hour. Again, I know that really is not going to work in New York City, but for the example. So again, you really want to calculate it based on hours. If you're at a 40-hour work week and you know the average hourly salary, divide by 2,080 hours, because that'd be 40 times 52. If you're at a 37.5 is your normal work week for people, off the top of my head, I believe that's 1,950 hours. So again, think about what your normal work week is, and if you only know the annual salary, divide by 52, then the normal hours worked in a week if they were working full time, and that gets you to your hourly salary. Okay, so let's, any questions about calculating salaries before we go on? Okay.
I have a question.
Sure, go ahead.
Okay, I just want to make sure, when you say it's through September 30th, you're talking about calendar year, not DISRP year, right? January 1st through September 30th.
Yes, we're not, okay. You are correct. So whatever's going on at September, we're not even thinking calendar years, we're looking at a snapshot in time as of September 30th. So that's a good point for vacancies. Vacancies, we're just looking at the snapshot also. So on September 30th, what does my workforce look like? How much am I paying this? How many people do I have, and what are their FTEs? Because we're not looking for really even the previous year, because we're not asking for turnover, so we don't care about what's going on throughout the year, just again at that snapshot. Okay, let's see. Any other questions about wage? Okay. So fringe rate. Fringe rate is a little complicated. I think more so for CBOs who aren't used to this. I think those of us who work in the hospital industry kind of see this all the time. Fringe rate is what benefits you give people that are either mandatory by New York State or the federal government, or voluntary based on either what you give somebody when they walk in the door as a hire, or what may be under their union contract. So mandatory things could be FICA, workman's comp, things like that that you need to pay out that's a cost to you. Voluntary things under fringe benefit could be life insurance, health insurance, disability, things like that, educational allowance maybe, anything that, and what you need to do is kind of calculate what the total cost of that is per person, unfortunately, or per title, and then figure out what that is a percentage of your total salaries. And for organizations either who have HR systems, that's going to be pretty easy. For organizations that use accountants or use some kind of payroll service, that's going to be fairly easy. They'll have the information. For those that do it by hand, it may take you some time, and please call me if you have any questions. So it's a percentage. So again, if your payroll is $100,000 and you find out that your benefits are $20,000, your fringe is 20%, and that's what we're looking for. And the reason why they're asking for hourly wage and fringe is to really try to understand what changes are happening from a financial point of view as people may be moving from one job to another. And I don't know, I haven't talked to either Isaac or Sarah in a while about what changes have been going on at your PPSs, but if someone went from an inpatient setting to an outpatient setting, there's going to be a financial change possibly. And that's what we're trying to check, what DOH and the disparate people are trying to look at, what that potential change is. Okay. So I'm going to do that in a second. So the final thing I want to talk about is collective bargaining agreement. So, and we're asking this again by title. So if anybody in that title is covered by a collective bargaining agreement, check that box, please, at the end. It's a yes/no box, and just say yes or no. But remember, it's anybody. So, and this is somewhat unlikely, but if you got 50 people in a title and 40 are covered and 10 are not for whatever reason, then you click the box yes, because at least some of them are being covered. Okay. And as I said before, this is kind of an addition to Section 1. If you say I have more than one organization or one site for my organization, this is where you list sites 2 through whatever, 2 through 15. And just list their address. That way the PPSs understand and we understand who you're reporting on. Okay, so let's, actually we've kind of gone through this quickly, which gives you back some time. So again, just want to stress a couple of things. It's one survey for each facility type, so if you have multiple surveys, regardless of where their location is, multiple facility types, regardless of where their location is, you're going to be filling out multiple surveys. So if you've got an Article 28 inpatient, you got a home health care, and you've got a nursing home all on the same site, that's 3 surveys. If you've got Article 31 or Article 32 inpatient, maybe inpatient, outpatient because you do some day treatment, and then you've got some residential, you're doing some group homes, that's going to be 3 separate ones. One for the inpatient, one for the outpatient, and one for the group home, which would be covered under other. Remember to use us as a resource as often as you can, as you need us. As I see some of the names up who are on this, I know I worked with you 2 years ago, so we're going to work with you again to help. So, Sarah and Isaac, do you have anything to add right now? And then I'm going to open it to the general floor for more questions. What?
I don't have anything to add, Robert. I think you covered it all.
This is Isaac, the same here. Thank you, Robert, for the quick and comprehensive overview. Okay.
So survey due date is December 1st, and again, it's based on data from September 30th. You can mail the surveys back to the thing that's listed. You can just mail back the whole PDF, and we're just going to download it. I do want to, again, open up for any general questions and as much as possible give you back some time for your day. Any questions? So you can either chat box, raise your hand, or yell it out. Are we unmuted? We're going to unmute you just now. Okay, so everybody's unmuted.
Okay, so everybody's unmuted.
Any questions?
Any questions?
All right.
All right.
All right, so I muted you back, so I'm on speaker and it kind of reverberates back. All right. So with no questions, I want to close this. Thank you for everybody for attending. Please reach out to us if you have any questions.
Number, flip to the next page, phone number.
I'm sorry?
Flip to the next slide.
Oh, next, I'm sorry. Lauren's reminded me. There we go, my contact information. So please reach out to me, either my email or my contact information again there, or my phone number or my email. There is our website information, again, and I know we sent it to you when we did our initial mailing. And please reach out to us if you have any questions. I thank you all for your attention and those great questions, and talk to you, some of you soon. Thank you very much, and have a good day.